Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hello, Chicago. It is April, and April is the National Minority Health Month. Here in Chicago, we like to say it is the month where we talk about the health of the Black and Brown community. And today we are going to be focusing on the theme of the National Minority Health Month, which is the social determinants of health. What that means is, what are the social needs that impact the health of Black and Brown communities? And today I have here with me the regional director of the Department of Health and Human Services, Director Cabonargi. Welcome to the podcast and welcome to our show. Before we dive in, we are going to start off by hearing about your background. Tell us a little about yourself, and you can tell us how did you get into public health? How long have you been in public service? And how did you get into your current role at HHS? But welcome, Director Cabonargi.
Great. Thank you so much, Dr. Ige. And we're so excited to have you in Chicago, leading the Chicago Department of Public Health. We know how lucky you are. And at HHS, we're excited to partner with you and our other local leadership. So yes, as you mentioned, I'm the regional director for the U.S. Department of Health and Human Services for the Midwest. And that's the Region 5. So that's Illinois, Wisconsin, Michigan, Indiana, Ohio, and Minnesota, and our 34 sovereign tribes, 12 tribes in Wisconsin, 11 in Minnesota, and 11 in Michigan. And it's important for us to realize that sovereign tribes have the right to access the Indian Health Service for their medical needs, or they can choose to have their own sovereign medical systems as well. But my path to HHS is just kind of a continuation of my public service. I'm a political appointee. The White House appointed me in January 2023 to be the regional director. Just a little bit about me. I'm a first-generation American. My dad came to this country from Italy and really stressed on us the importance of giving back to this country at every opportunity. I had the opportunity to work for my first boss, who was probably my favorite and most important boss, was U.S. Senator Paul Simon. And then I worked for Senator Dick Durbin for many years. Went to law school. I was a federal prosecutor at the Securities and Exchange Commission. And then the chief judge in Cook County, Tim Evans, appointed me to be a commissioner on the Cook County Board of Review. My term ended in December of 2022, and the White House appointed me in January 23. A big part of my job as regional director is opening the door up to HHS, to our public health officials, such as yourself and others. All of what we call the operating divisions at HHS have a regional presence, and it's my job to make sure that we can access them. And for your folks listening, I will now do some alphabet soup, but hopefully they'll recognize them. That means CMS, which is the Center for Medicaid and Medicare Services. That's ACF, the Administration for Children and Families, because ACF operates Head Start and regulates all the child care centers. ACL, the Administration for Community Living, that regulates the Older Americans Act and all of our senior care facilities, including nursing homes. The FDA, the CDC, ASPR, the Administration for Strategic Preparedness and Response. Folks may be familiar with them through the COVID-19 public health emergency. All of those have a presence here in the Midwest, and it's my job to make sure that when people need access into them, to make sure that their public health and human service needs are met, that we're here for them.
Well, thank you, Director. That is a lot of work. You're a busy man. So we appreciate you coming here and spending some time with us. So for communities of color, many times we are not always aware of what resources are available to us and how to access these resources. And when we talk about health, many times people equate health to healthcare. And the Chicago Department of Health, we try to look at health holistically and know that we recognize that health starts even before you get to the hospital, at home, in your community, what food you have, the quality of the air that you breathe in, access to food and other services. But we also understand that the access to health services is so vital. So it gives me a lot of joy to hear that there is a regional presence of health and human services here. And you serve as the director of the Great Lakes region of the U.S. Department of Health and Human Services. So in your day-to-day, what does that look like? Who do you work with? Who do you collaborate with? And how does that impact the health of the people of Chicago?
I love my job, but every week is different. As much as I try and plan my week ahead, sometimes it can change. My title as regional director used to be the secretary's representative, and that's really the best way to look at it. Is I represent Secretary Javier Becerra in the region. So last week, I was in Minneapolis to speak at the Minnesota Hospital Association's Leadership Institute, which is the CEOs of the hospitals in Minnesota. We were talking about some of the benefits of the Inflation Reduction Act that are available to them, some changes in Medicare and Medicaid payment systems, really some exciting developments we're making in behavioral and mental health to expand access and make it more affordable. The week before that was in Michigan for a week of meetings in Lansing, Michigan, which is their state capital, including meetings with Governor Whitmer. A week before that in Ann Arbor with Secretary Becerra and Congresswoman Debbie Dingell, and again, Governor Whitmer on the access to IVF and fertility services. Reproductive health is also in our portfolio. So we see that women's rights to choose their own reproductive health decisions, whether it's contraception, fertility, when and how to have children in their life, all of that comes through HHS, and President Biden and Vice President Harris have us in every room, whether it's the courtroom or the boardroom, fighting to protect those rights.
So, Director, tell us about health insurance coverage and the advancements that are happening in that space.
So, probably for most of our lives, we've heard about the disturbing number of people in this country who are uninsured. That if they or their family got sick or injured, it would bankrupt them because they didn't have the ability to go to a hospital or a doctor. I'm really pleased to say that the number of people uninsured in this country is the lowest that it's ever been. Over 300 million Americans have insurance. And that's an extraordinary accomplishment, whether it's employer-provided health care coverage, Medicare if they're a senior, Medicaid if they're a lower income, or people accessing the Affordable Care Marketplace. 21.3 million people chose an ACA Marketplace plan during the record-breaking 2024 open enrollment period. More than 25% of those people were new to the marketplace. So we know that the Affordable Care Act and the marketplace is working. We know that the word's getting out. This is a shout out to our navigator partners who get out there and help people make the right decision for them and their family. 4 out of 5 Chicagoans can find a plan that's less than $10 a month. So again, back to, in talking about the Inflation Reduction Act, one of the things that President Biden fought for was to make sure those subsidies were stretched out from 2024 into 2025 and 26. So again, 4 to 5 Chicagoans can receive an affordable plan for them. And we want to make those permanent. And that's something that Secretary Becerra is fighting for as well. Because again, if all these benefits have to be out there, people need to go out and take advantage of them.
Thank you. Take advantage of the benefits. That's the message. There are a number of reasons why I'm excited that you're here with us today. So we have a direct line to Secretary Becerra. We have lines to the governor. We have lines to CDC. It appears through you. So I am going to take this opportunity to highlight for you the priorities for us in Chicago, so that you in turn can help carry our message to the higher ups for the issues that we're wrestling with in the city of Chicago. As you know, Healthy Chicago 2025 has been a priority for us. The Chicago Department of Public Health has a mandate to help make Chicago healthier and safer. But we have observed over the years that communities of color just are not getting the same kind of resources and support that they need to stay healthy. The communities are underserved. The communities don't have the same resources, and access to healthcare has been a challenge. So we have been lifting up this issue so that all tiers of government can collaborate and work together to address these issues, including the social services and the social determinants, food, housing. So I've heard you talk about reproductive health. These are issues that particularly disproportionately impact communities of color. This week, for instance, is the National Black Maternal Health Week, and we see just tons of disparities in our communities. So I am glad that you're here having this conversation. We're very excited about all the work that you're doing. And you mentioned the Inflation Reduction Act. So for the people of Chicago who were wondering, what does IRA mean and how can we tap into this, resources that are available there?
Absolutely. If I can jump back before I start talking about the benefits of the IRA, which listeners should continue to listen to because it's going to save them money right now because the medicine in their medicine cabinets is probably going to become cheaper, as well as their access to vaccines. This is a perfect time for us to talk because April is National Minority Health Month, and the city's focus on getting outside the health and human services to what we would call the social determinants of health is so important and so in line. Each year, well, first of all, as a step back for the origins of National Minority Health Month, it was created in 1915 by civil rights activist and author Booker T. Washington, who had the idea of the National Negro Health Month, which in 1951 was changed to National Minority Health Month. But that tells you that its origins were helping it in people of color. So every year, our Office of Minority Health at HHS designates a theme for National Minority Health Month. And the theme for 2024 is Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections. And it's about understanding how the unique environments, cultures, histories, and circumstances, which as we've talked about, are known as the social determinants of health, of racial and ethnic minority and AANIP, Asian American, Native, Hawaiian, impact their overall health. It's non-medical factors like poverty, limited access to healthcare, lack of education, and racism. They're all examples of SDOH that contribute to health disparities and inequities. And we know that SDOH impact nearly everyone in one way or another, and simply promoting healthy choices won't eliminate health disparities. We have to consider the conditions in the environment where people are born, where they live, where they learn, work, play, worship, and age, and it's fundamental to improving health and reducing long-standing disparities. So it's a great time to talk about it. And as you mentioned, the Biden-Harris administration is really excited about the Inflation Reduction Act because it really starts to break that down. So the Inflation Reduction Act, folks may know because of some of its green energy and its infrastructure pieces, but there's huge health benefits to Americans, and they start right now. So right now, anyone who is in Medicare Part D has access to the vaccines that the National Vaccine Council in the White House has said are beneficial and needed now. So that includes shingles, for example. Shingles is a 2-shot vaccine regimen. They can cost up to $300 per shot. Secretary Becerra and I were in Milwaukee recently doing a roundtable with older Latino couples. And the secretary asked a couple if they'd had their shingle shot. They said yes. He asked them, how long has your doctor? And they started laughing. And he said, what's so funny? And they said, if you had asked our doctor how long he's been telling us to do shingles, years. But at $300 a shot, that's $600 for one person. It's $1,200 for a couple. It's not that they don't know they need them. They just don't have $1,200 to get shingles. Now, thanks to the Inflation Reduction Act, they can get shingle shots for free. There's a $35 cap on insulin per month for people with Medicare. And requires drug companies to pay a rebate to Medicare if they raise the prices faster than the rate of inflation. That's huge. But the one that we're getting probably the most attention for that I think is going to have the longest impact is finally Medicare and Medicaid have the authority to negotiate prices for certain prescription drugs. The Veterans Affairs Administration's hospital have had the ability to negotiate with the drug companies, and now Medicare, which is the largest producer or the largest purchaser of prescription drugs for seniors in this country, has the ability to negotiate. CMS has identified the 10 most prescribed, most expensive drugs, and started to negotiate with the drug companies. And those benefits will go online in 2025. But it's important to look that we're not done, as President Biden would say, because in 2025, we're going to negotiate 10 more drugs, and that's going to expand in 2026 to 20 drugs a year. So, for people here in Illinois, that's more than 280,000 Medicare enrollees take drugs selected for negotiation. And that's 142,000 people who take Eliquis or Xarelto for cardiovascular disease to prevent blood clots. That's 91,000 people with type 2 diabetes who might take Jardiance or Januvia, and then 17,000 or more Illinois seniors who take Entresto to treat heart failure or other cardiovascular disease. So again, if you're an Illinois or a Chicago senior, go in your medicine cabinet right now because you might want to have a conversation with your doctor and your pharmacist.
Oh my word. This is good news. Chicago, did you hear that? If you are a senior in Chicago and you're on Medicare, this is good news. This is important because chronic disease is by far the largest reason why Black people are dying younger than the age of 65. So this is good news. Now you can get your vaccines, including shingles vaccines. I am reiterating that vaccines are important. Prevention is always good. Whenever we can do it, let's do it. And now it is at no out-of-pocket cost to you. And also, Director Cabonargi is also reiterating that if you are on medication for diabetes, especially insulin, the cost is now much lower than before, so you can get the treatment that you need. And there are many other drugs, especially for heart disease and for diabetes, that keeps communities of color bound to medical debt and high cost of healthcare that can now be reduced. So we're very appreciative for all of these initiatives happening at the federal level. Healthcare is the responsibility of all of us, federal, state, and the local health department. So we are very excited to help push this message out, make sure that Chicagoans are benefiting from this. 280,000 Chicagoans can benefit from this, and we will help get the word out. So, Director,
can I give a shout out to you and your team for a second? We really rely on our public health professionals. Once we're saying we're making these vaccines available, shingles, flu, and other vaccines, we need our public health departments to be organized and mobilized. And CDPH does a phenomenal job of, in the communities, in the wards that need it, making these vaccines available for free or low cost in the communities to serve people where they are. And you know this, Dr. Ige, that we meet people where they are in public health, but we don't leave them there. And you put these resources out in the communities that need it so you can help them how they need to be helped.
Thank you. That is a commitment from CDPH. We want to find the resources. We want to bring those resources to our communities. And we want to ensure that everyone can access those resources. And if that requires us bringing the vaccines to the community, that's what we're going to do. So we are also very excited about the work that is happening with Medicaid and the work that's going on there. Reproductive health, you mentioned. So there are other prescription drug benefits that is being explored for the future. And as we hear these laws roll out, we will do our work to get it out to the community and make sure that Chicagoans are benefiting from it. So are there requirements to qualify for this benefit? Is everyone eligible, or are there certain groups that are eligible or some groups that are not?
Great question. So right now it's seniors. So it's specifically seniors on Medicare right now. But as we've seen, it's really expanding out so that, for example, a few days before the Medicare Part D benefit for seniors with insulin went into operation, where seniors on Medicare had their out-of-pocket cost cap for $35 per month. Eli Lilly and some of the other drug companies expanded it beyond just Medicare. We're seeing that same benefit when these first 10 drugs start to be negotiated. One of the benefits here is it really brings some transparency into the process, because so many seniors have been frustrated having no real transparency into why it costs as much as it does. And the president also issued an executive order in 2022 instructing HHS to explore lower prescription drug costs. But it wasn't just lower prescription drug costs. He also included therapeutics. We've seen some phenomenal breakthroughs in gene and cell therapies for some horrible diseases, where we've seen some of the smartest scientists come up with some therapeutics that are going to help save lives or prolong lives, but they're just put out of the reach of folks. And we know that if it's not affordable, it's not accessible. So we were also proud earlier, in February, with the leadership of Governor Pritzker here, that Illinois has signed on to the cell and gene therapy model. So it's similar to the model that we're using with prescription drug negotiations. CMS, Medicare and Medicaid Services, identified one disease, and we're going to use that as an example for gene models. We picked sickle cell. There's 100,000 Americans that have sickle cell disease, more than 5,000 Illinoisans. More than 55% of people with sickle cell are African American, and more than 50% of sickle cell are currently on Medicaid. So it's an ideal patient class to look at for Medicaid and for the federal government to get into. And what we've said is, if states want to partner with us, we'll take their patient class and we'll add it to others. And similarly, as we're doing prescription drugs, we're going to negotiate cheaper costs of these therapeutics. Last year, 2 new gene therapeutics came online for sickle cell. One cost $3 million and the other cost $2 million. Again, if it's not affordable, it's not accessible. So we're going to take all of this buying power of all of these patients that Medicaid, in many cases, is already paying for and negotiate with the therapeutics companies to drive those costs down.
Wow, wow, wow. If it is not affordable, it is not accessible. Thank you, Director Cabonargi. I have written that down. If it is not affordable, it is not accessible. And there are other things that I'm excited about in just the overview you've given. That's sickle cell disease. I am a carrier myself of the sickle cell gene. I got lucky, my children, I have one of my sons who also is a carrier of the gene, but my sister has 2 children that have sickle cell disease, and it has been a very painful journey. And so the possibility that there is a future in this country where Black people can access the care that they need and have that hope of a cure that will be accessible to them and affordable to them, I think will be a game changer. This has been a long-standing issue that didn't get the kind of attention that is necessary. When you think about the suffering that people with sickle cell disease go through all of their lives, I think it just makes me almost emotional to know that there is a future where treatment and care will be accessible to communities of color. So I will be keeping a very close watch on that for when that will be available and how we can promote access to these resources and support for Chicago. We also know that there are many other areas where communities of color are disproportionately impacted. We've talked about chronic disease, especially heart disease and diabetes, and the efforts there at the federal government to make care more accessible. You've talked about, reproductive health and making care accessible, and now you've talked about sickle cell disease and making care accessible. One other area that we want to lift up is the Black Maternal Health and the crisis in that space. In Chicago, it is just heartbreaking to know that Black women are at a higher risk of dying from pregnancy-related causes in Chicago. And we have healthcare systems all around us. This is not a city with a healthcare desert. So we have been working really hard to address these issues, understand the root causes, and how we can better support our community to get the care that they need. Would you say that this is also on the radar of HHS? Is there anything we can look forward to in that space to bring resources to our communities here?
Absolutely. This is one of the matters that Secretary Becerra says is whole of department. As I ran through all of our departments and operating divisions, Black Maternal Health runs through all of them. So, for example, HRSA, which does our workforce, has put more money available for grants and student loan forgiveness for providers who want to go into Black Maternal Health. We've also done the same for behavioral and mental health counselors. We know that if someone looks like you and has a shared life like you, you're going to get a better health outcome. We just see that. NIH is doing more training and collecting more data points on women because we realize that we've undervalued women when we run our reporting. And the folks at NIH would say, you measure what you treasure. And if we're going to have a better outcome with Black Maternal Health, we have to start measuring it earlier and get better outcomes, and then bring that back to the provider universe. We've just seen, we've heard the horrible stories from women who doctors and nurses are not listening. They're not hearing them. They're not listening to the fact that they're in pain or they're uncomfortable and their bodies are sending them signals, but the doctors and nurses need to be trained differently. So NIH is working on a better training for that as well. And then just really getting into the workforce pipeline. And we saw so many medical professionals leave after the public health emergency ended. And we need to make sure, especially for young people, that they're making a career of it. Recruitment is one thing. Retention is harder. thing to crack, just because we ask so much of our doctors and nurses and medical professionals. So we have to just keep working and keeping them in the system, and that's just not just words. That's real resources available to them.
Thank you, Director. I have heard a lot of good words today. It gives me joy that the issues that are priority for the Black community and communities of color is also rising to priority at the federal level. For seniors, for women, for the Black community and the brown community, the things you're saying today gives me some level of hope that the gaps that we see in life expectancy in Chicago, we will be able to make progress because of some of these changes. And one change that is really important is having providers, healthcare providers that represent the community, that look like the community, that have shared lived experience, so that we understand what people are dealing with and we know how to best support them. We know that in Chicago, even when there are healthcare facilities available, people of color sometimes choose not to go there because of how they are treated. The folks there don't look like them, they don't listen to them, they don't prioritize their issues. And so to hear you say that we are paying attention to these issues, looking at the workforce pipeline, how can we better support young people to choose healthcare as a profession and then stay in healthcare so that they can also continue to serve the community? This is also a message I want to put out to Chicagoans. Are you a young person there? Healthcare is for you. Black folks can be doctors, they can be nurses, they can be therapists, they can be anything that you want. And we want you in the medical profession. We want you in the healthcare workforce. We want you in the public health workforce, so that we can continue to better serve our community. We're very happy that you're here today, and we just want to offer up our support and collaboration and partnership. Our mandate in CDPH, our mission is to keep Chicago healthier, safe, but also equitable and resilient. So today, this month, we're lifting up the issues that disproportionately impact the Black and brown communities and making sure that our federal partners, our state partners are aware of our issues and then offer our support to collaborate and work together to address these issues. So as CDPH, how can we partner with HHS to help address some of these gaps?
Well, first of all, I'm pleased to say we already are working a lot of initiatives. When things come up, last summer we had an Mpox episode, and then recently we've had measles present itself. We're really lucky to have a mature, well-developed, well-resourced CDPH. Because when, for example, our epidemiology teams from CDC come in, they've got professionals to work with here. One thing that came to mind, because we were just talking about, is on the topic of Black maternal health. President Biden has acknowledged that there's many things that work. We just need to put resources behind them. Mm-hmm. So we've seen the value of doulas and breastfeeding. On the Medicaid lines, we're increasing the funding for that and making it more accessible. Chicago has done a great job through CDPH of really acknowledging the value of that and getting it out in the communities. But boy, there's so many ways we work together. I know we're working together now on getting ready for summer vaccine season, because there's going to be young people who are going to need to get their vaccines for the summer. We're going to be doing our back to school vaccine drives in the fall. Mm-hmm. We're going to be doing our senior focused programming as well. Just so many ways we can work together. And it's things that come up, because I'm not all my region is the same. Chicagoans should know that the benefit of having a CDPH that's working for them year round means that as things come up, that there's a talented professional workforce here for us to work with.
Thank you, Director. We appreciate the partnership. You were there for us when measles, the outbreak was announced. You reached out. We were able to have a conversation, and you're always advocating for us. Once I started in this role, the mental health work that we needed to get started, we reached out to you. You immediately responded. And so in many other areas, the mental health summit, you were there in person, and you're here again today to listen and to share resources and opportunities with us. And so Chicago, as the commissioner, as the city's doctor, our commitment is that we will continue to work together elevate our issues. We have here Director Cabonargi, who is listening, who is a close partner, who is taking our issues to the federal and helping to bring resources to our city. So we thank you very much for your partnership and your interest in this work and your support to CDPH. From the day one that I started, we have enjoyed that collaboration. Folks, it is National Minority Month. That means that our health matters. We know that there's so much going on. People are trying to put food on the table. People are trying to get to work, but health matters. Your health is important to us, and we want you to know that there are resources out there to support you. Resources for how you can access services, whether you have insurance or not. There are services in Chicago for everyone. For those who don't have health insurance, there are a spectrum of federally qualified health centers that we work with to ensure that services are close to the communities. CDPH also has mental health services, immunization services, sexually transmitted infection clinics, immunization clinics at the communities that you can access at no cost, even if you don't have health insurance. And we will continue to bring resources to you, information on how lower prescription drug cost can benefit Chicagoans, how our seniors, those on Medicare, can access these resources, where you can get the vaccinations that you need. And above all, we want you to take care of your mental health. If you're feeling down, if you're feeling sad, please reach out to someone, talk to someone. We have services all across the city where you can access help if you need it. So your health matters. The fact that you're Black or brown is not a reason why you should have inferior health care or inferior services. We are committed at CDPH to make sure that healthcare and health is accessible, affordable, and equitable. And we thank you, Director Cabonargi, for coming today, spending some time with us, and we will continue to work together to address the health of Chicagoans.
Dr. Ige, thank you for your leadership and your partnership. Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.